Kabul. We don't have, only on Friday there's off. I had a patient who came from US. He came and said, okay, he asked me about the ozone. Then I said, he said, okay, I will talk with my friends. And he went back and disappeared for 2 days. Then he came and he was yelling, shouting. I said, what's wrong? What happened? Someone tried to do block for him. And I think during the block, they injured the nerve. And he had a very bad condition. And I need to inject a painkiller for him to just sit for a while there so I could talk with them. And I also said that, okay, what do you want now? Now you are very in worse bad condition. What can I do for you? He said, whatever happened, just go for ozone. And Alhamdulillah, today at morning I received his message. He is doing well, Alhamdulillah. He said he also prayed for me, and hopefully we'll get better inshallah in future. Well, this journey which started, it was not as smooth as we thought. It has its ups and downs. We faced difficulties, problems. The first and main was awareness of patients about ozone. This is very challenging when you start first ozone. So I had to explain every detail, every small detail to the patient. I had to explain them in your own language. It took me like 30-35 minutes to talk with them, to convince with them. Sometimes my colleague, Dr. Khalaq, say, oh, you talk too much. And I said, okay, patient should. For me as a doctor, I always might tell patient that the patient has right to know what happened to him or her. And then we as a doctor gave him information and offer him the option of treatment. So you should choose, you should have the authority to choose, and you should know what happened and why he or she feels pain. Second one, socioeconomic. We have this issue back there as well, but I'm not sure about the place where Dr. Omar came. Do they have this socioeconomic? Free, yeah. So we have this issue as well, so we have to be careful when offering the patient the treatment. This one also poor referral system. This is also, it can be, I cannot cope with this till yet. 95 to 98% of my patients come to me through my previous patient. No other of my professional colleagues, they are not ready to refer. I don't want to go to the detail why. I had to, although I have discussion with them, I show them the studies, at the end they will say, okay, we need some more, or maybe one of them said that, okay, it's not approved yet. So I don't know, is it the reason or some other thing? I don't want to talk about that. And this belief is of patient. This is also related to the awareness. When we give information about ozone to the patient, he or she happily accept the treatment. So I want to say it again, explain to your patient. Very, very small detail. Explain to this is what I will do. And we also even we tell them that 4 and 6 weeks what he or she should not do, or he or she should do. So they accept that. At the conclusion, I would say that ozone nucleases provide excellent pain relief in most herniated disc patients who fail to respond to conservative therapy. Also, as you saw in my data, 91%, the result was like 90% till now. And I don't know about the next 10 months. Hopefully, it will remain the same. And the second, decreased requirement for a conventional surgery. Decrease in hospital stay as well as cost effective. However, this is my one point I want to raise here or suggest. As I said, that poor referral system, we need more studies or more events like this. Need to be done to evaluate the long-term outcome of ozone nucleasis therapy and its effectiveness. And I think the studies should be, through a stage should be shared with other colleagues as well. And I think that we should engage the authorities who is responsible for our health system and society to convince them. That's what I'm doing back there. I'm trying to contact with health ministry to convince them about the ozone. because if it's a, medical, anything can happen, so it's a big risk. And for me, further studies, further documents has to be should be done to show the people, to convince them, not only the concerned people, to our colleagues, to refer the patient. Because for me, if a patient can be healed with ozone therapy and he go surgery for surgery, it's very unfair. He or she should not go for that, because as Umar said that I, as a human, as a Muslim, I will not accept that for myself or my family. And then I am finished with this beautiful supercar, which is the first ever made by Afghanistan. Thank you, sir.